That breaking news, we've learned someone who attended the watch party for Kansas congressional candidate Amanda Atkins has tested positive for the coronavirus.
The Atkins campaign says the person was wearing a mask and they are asymptomatic. Atkins will be getting tested and will self-quarantine out of an abundance of caution. The campaign is now working to notify everyone who attended that watch party.
As health officials try to get a hold on testing backlogs for COVID-19, they're also trying to play catch up on contact tracing after someone tests positive.
Investigative reporter Matt Fleener looks at a new way officials are trying to speed up contact tracing in Clay County.
Throughout this pandemic, health officials we've spoken with agree testing doesn't do much good without contact tracing and disease investigation. But here in Clay County, they've actually found a way to speed that up. Last month, the Clay County Public Health Center started using what's called the Sarah Alert system. It basically frees up the tedious job.
What bus were you on?
Of health workers contacting people every day to check on their symptoms.
It's a great system. It was developed for public health specifically for this purpose.
Once the department knows you have COVID-19, you're asked to enroll in the Sarah Alert system. The information is secured in a database, and the health department asks you for your contacts for contact tracing, making those calls manually. But where Sarah Alert really helps is freeing up staff to do more contact tracing by sending you daily automated check-ins so health workers don't have to call you.
Between having new disease case investigators and new staff and having this system, we're pretty much able to keep up with cases as they come in.
Health officials here in Clay County say it's helped to cut down on any backlogs. Disease investigators are able to keep up now. And by the way, the information is secure in this Sarah Alert system. Matt Fleener, KMBC 9 News.
Both Wyandotte and Cass counties also use the system. It is free for health departments to use. We have updates from both sides of the state line on the coronavirus. 921 new cases reported in Kansas since Wednesday. In Missouri, 996 new COVID-19 cases reported in the last 24 hours, with 21 new deaths statewide. The percentage of positive cases is down in both states, according to the COVID Tracking Project. Kansas is now at 11.8. Missouri is down more than a percentage point to 11.2. It is one of the most effective ways to track the spread of the virus.
Doctors at the University of Kansas Health System say they want to squash rumors that COVID-19 is similar to the flu. They say there have been 6 times as many deaths so far in this pandemic than there have ever been in a flu season. The doctors also say the two illnesses don't affect patients the same way.
A lot of deaths also with influenza occur because of secondary infection, a secondary pneumonia with a bacteria, either typically staph or strep, rather than just having the inflammatory or immune dysregulation that we see with COVID-19. So they are wholly different. You can look at the numbers just from a few months in the United States alone compared to a whole year or a couple seasons even of influenza.
The doctors also point out there is a vaccination and other treatments for the flu. So far, we have none of that for COVID-19.
However, this week, one of the most promising vaccines moved into the final stage of testing at Cincinnati's Children's Hospital. Pfizer researchers say the vaccine is safe. Now they need to test its effectiveness. And now they're testing how effective it is against COVID-19. Mass vaccinations will most likely happen next year. High-risk people like frontline workers and first responders could get vaccinated in the coming months. People living in hotspots too.
So you can see by zip code where people are going to doctors or where people are doing things, and by that they can get an idea of where outbreaks are, and then they can start looking in the areas for hotspots.
Researchers need between 500 and 1,000 volunteers for this final phase. The Moderna vaccine entered its final stage of testing last month.